Welcome. We are thrilled you are joining us for an important conversation with audiologist Dr. Susanna Storm, entitled Navigating the Soundscape, presented by Ashby Village's Hearing Loss Support Groups. Many of you are familiar with Ashby Village, some are not. We are a dynamic community of people transforming how we age. We support each other to age wherever we call home, with companionship, with care, and with inspiration. We have about 450 older adult members, 250 volunteers of all ages, and a dedicated network of partners and supporters. If you haven't already, I encourage you to check out the meaningful ways to get involved as a member, a volunteer, or both. Ashby Village is happy to present these kinds and this quality of programming free of charge, so it's accessible to everyone. If you're able to support our ability to offer free programming, please donate to Ashby Village. There will be a link to donate in the chat and also in a follow-up email. Before I turn it over to Nancy Rubin, who will introduce Dr. Storm, I'd like to say that Nancy is a longtime member of Ashby Village, a member of our hearing loss support group, and an extraordinary volunteer photographer for us. Nancy also has a deeply enlightening exhibit on hearing loss called Sound Advice that is currently on display at Epworth Church, where we also have our offices, and available online. We'll put a link in the chat for more information about her exhibit. All right, Nancy, take it away.
Thank you, Bat, for your very kind words. I really appreciate it. I'm one of some 50 million Americans with hearing loss. And because you are here today, I imagine that you or someone you care about also has a hearing loss. For most of my life, my hearing was excellent. My first teaching job was with visually impaired, and my blind students taught me to really listen. They would say, "Susan is coming up the stairs," and I asked them how they knew that. And they would say, "It's how she taps her cane and the way her shoes touch the ground." My hearing became very fine-tuned. I really paid attention. In addition, my father was extremely hard of hearing, so I often felt I was an extra pair of ears for him. However, about 14 years ago, my hearing changed. My journey with trying many different kinds of hearing aids began. I joined a hearing loss support group at Ashby Village, which has been a great help. We share our challenges, frustrations, discuss the latest tech gadgets, and are proactive in our communities. Several members of the group also belong to the East Bay chapter of the Hearing Loss Association of America, and we heard Dr. Storm's excellent presentation there. We decided that we wanted to bring her knowledge and expertise to the Ashby Village community. By the way, there are currently openings in both of these support groups, so if you're interested in joining, please call the Ashby Village office. Dr. Storm will tell you about her history and professional path, but I was curious what she does when she's not looking for wax in her patients' ears. To celebrate her doctorate, she did a tandem skydive with her dad. Susanna is also a scuba diver, and her favorite sound happened on a recent trip to Maui, where she heard whales talking underwater. Other sounds she makes. She's been playing the piano since she was 3, mostly classical and musicals, and she also composes. At the end of her talk, there'll be plenty of time for Q&A. Please put your questions in the chat. It is my pleasure to turn the program over to Dr. Susanna Storm.
Thanks, Nancy. So I am so excited to be able to present to you guys today. My name is Susanna Storm. I'm an audiologist in the Bay Area. I've been in private practice for almost 10 years now in Berkeley. And after I had talked to Nancy and we had talked about doing a presentation, I kind of had this huge flood of information that came to my brain because I was thinking, there's so many things that I want to cover. But I figured you didn't want to be here until tomorrow. So I decided to narrow those things down to some key kind of components. And if I'm lucky enough to come back to talk with you guys again, I'd be happy to go into a topic in more detail. So here's what we're going to do today. I'd like to just go over me, my practice, kind of where I come from. Then we're going to talk about the kind of the heart of all of this, which is going to be hearing and cognition. We're going to talk about the importance of auditory training. We're going to talk a little bit about hearing device technology, accessories, what's kind of going on in the field, what's new. And if we have time, I'm going to broach the topic of tinnitus, as well as some really unique hearing research that's going on in the field right now. So this is my family. This is actually a picture we took recently in Cozumel together. On the right-hand side right here, that's my father. He is a retired dentist. Next to him is my mother, and she's a retired hygienist. They both owned a dental practice for about 40 years and was really an integral part in influencing my philosophy in how to take care of people and how to run a practice. I learned all types of things from both of them. I learned that the reception room should never be called a waiting room. Your time is really valuable as a patient, and there's really nothing more frustrating than getting to your appointment at 2 o'clock and then being seen at 3 o'clock. My father also taught me that education and humor can be combined in order to convey information and make it stick. My mom taught me that the educated patients, those are your best patients. She also taught me about the importance of having a compassionate heart. And we know during these times and days that we all need as much compassion as we can get. You know, it was just these very simple ideals. I mean, it's not revolutionary, but it really, you know, when I did my 8 years of education, I took these ideals and I created a business to provide a service in a way that's been lost with time. Some of you might remember the days of physicians coming to your house to take care of you. That was my grandfather. He was a physician, and he would go to houses to see people. What a concept, because you fast forward 50 years later and you can't even beg for more than 5 minutes with a clinician. You know, medicine has really become really impersonal, and hearing is so personal. It connects us with the world, and it really deserves the time that it really needs. I've spent 22 years in audiology, improving the hearing of active adults with an emphasis on whole person care. And it's really my passion. You know, I often say to patients, if I don't get excited about your ears and hearing, who will? Just another little insight into who these people are. That's my brother, that's my sister-in-law, that's my wife, and that's me. Interesting little factoid, my dad, my brother, and my wife all have hearing loss. I would love to say that it's exactly the reason why I became an audiologist. It's a great story, but it really helps that I am because I have several family members that need it. So I have a practice. It's located kind of at the corner of Ashby and Telegraph. I'm right across the street from Whole Foods. When I opened this practice 10 years ago, I had no idea what a landmark Whole Foods would be for my practice, but man, it sure is. This is the inside of my office. That's me running down the hallway. And here we are right there, right across the street from Whole Foods. Here's my great team. I've had several individuals work for me, and none like these two. Emily and Amy were probably the biggest gift I could ever have. I've got two women that are incredibly intelligent, but also have huge hearts for people. So it really rounds off the whole entire group. Emily is on the left-hand side. She is my office manager. She's the awesome voice that you get when you call. Amy on the other side, she's my audiology assistant, and her fundamental job is to give me the luxury of spending the time with patients that they need. So now that you know just a little bit about us, here's what we know about you. Your hearing is a vital tool for connecting to those around you. Whether you're attending the speaker series at the Paramount Theater, maybe you're getting together with the Ashby Village Hearing Group, you're playing pickleball with your buddies, you're taking a show in at the Berkeley Rep, maybe you're playing with your grandkids. The list goes on and on. You know, you're in all of these types of environments constantly. And here you are in the dead center of it all, connecting to all of those around you. So let's talk about how we connect through hearing. Hang with me here. This is going to be a short anatomy and physiology. No testing at the very end. So what you're looking at here is you're looking at a picture of the peripheral auditory system. That includes the ear canal, the middle ear space, the cochlea, which is the organ of hearing, and the auditory nerve that runs up to the brain. Think of the peripheral system as the vehicle that gets the sound up to the brain. I always tell patients, this is a fancy vehicle for getting the sound up here, because up here is where we make sense of all that incoming information. So let's talk about how sound transmits through the entire system. Sound enters the ear, it bounces down the ear canal, it hits this little wiggly eardrum, and that eardrum will wiggle back and forth, setting 3 bones in the middle ear into motion. Those bones are called the malleus, the incus, and the stapes, but they're really locked together all as one, and they move as a chain. That's why we call it the acicular chain. As those bones move, they set fluids into motion within the cochlea. So that fluid is called endolymph. And there are millions of tiny little hair cells that dot the lining of the cochlea. And as that endolymph moves, the hair cells will bend back and forth, causing an electrical impulse to go up the nerve to the brain, and the brain says, okay, I heard it. So when you go get your hearing checked, we have you press a button for the softest sound that you can hear. Because what we're doing is we're evaluating the entire peripheral system to see how the system or how the sound is being transmitted. During our diagnostic testing, it also allows us to figure out where in the lineup the difficulties could be occurring. Okay, so I want to show you this really cool video that will kind of go through them in motion, how hearing works. And I'm going to try to mute this because this has some obnoxious sound here. It's going to have sound. Oh, it's an incredibly complicated system, but it's an amazing system. And this is all happening without you even having to think about it. It happens all day, every day. Except you might start thinking about it if the system isn't working as well as it should. Maybe you've noticed that it's harder to hear in restaurants, or that you're straining to hear the actor's dialogue at the Aurora Theater. Or maybe you're just tired of asking your granddaughter to repeat again. So let's pretend you fast forward, you've gone and you've had your hearing tested, and now you've been told you have hearing loss. Let's talk about the different types of hearing loss that can occur. 3 major types of hearing loss are conductive hearing loss, sensory neural hearing loss, and mixed hearing loss. So first, let's start out with conductive hearing loss. So when you have a conductive hearing loss, the issue is with the conduction of sound into the ear. So the issue will be an issue with either the ear canal or the middle ear itself. Think of something that's impeding the sound from getting into the cochlea. So we can say as simply as, if you have a big old plug of wax there, that can prevent the sound from getting down into the cochlea. Another thing that can prevent the sound from getting into the cochlea is if in the middle ear space there's fluid. That fluid can prevent sound from going into the ear canal. For conductive losses, this is typically a temporary experience because it's one that can be remedied by medication or surgeries. Sensory neural hearing loss. So sensory neural, it's a combination of 2 things. Sensory being the cochlea and neural being the auditory nerve. So when you have a sensory neural hearing loss, the loss can be coming from the hair cells of the cochlea and or the auditory nerve itself. This can be due to damaged hair cells. Remember in that video, you were seeing those little hair cells moving around? Sometimes those hair cells are damaged and they're not transmitting the sound like it should. Or maybe the auditory nerve is sending an incomplete message to the brain. This is a permanent type of loss and one that's remediated with hearing aids. This type of loss does not return to normal as a conductive hearing loss might, and will progress slowly with time. Now, audiology PSA. If we are lucky enough to have birthdays, all of us are going to have sensory neural hearing loss eventually. It's called presbycusis. Presbycusis is age-related hearing loss. And this is something that happens to all of us. The auditory system over time breaks down. We get to wear glasses after a certain time. I just got my first set of readers, so things are declining on me as well. But sensory neural hearing loss is going to come for all of us. But typically, it's how fast does it progress? That answer sometimes can be found in genetics. Nancy was saying something really interesting. She was saying, my hearing was great for many years, and then 14 years ago, something started to happen. She was also making that connection of Dad had hearing loss too. He had some stuff going on. So there can very much be a genetic predisposition to how fast our hearing can change. And it's exactly why when you come to the office, it's why we ask you things like, do you have a family history of hearing loss? Because that can help to lend itself to things that we'll look for in regards to possible genetic related hearing loss. Oh, the old mixed hearing loss. This is a lovely combination of both. So if one or the other is not enough, mixed hearing loss is a combination of both conductive and sensory neural hearing loss. So there's not only an issue with the conduction of sound, but there's also an issue of the transmission of sound. Here's some examples. Okay, let's start on the right-hand side. Conductive hearing loss. Remember, this is a temporary issue. So this can be seen with fluid in the middle ear space or an object in the ear canal. That can be wax. That can be beads from toys, which I've pulled out of kids' ears before. Conductive hearing losses can also be due to allergies. Allergy season this year is horrible. So if you're noticing your ears are feeling a little bit plugged up more than usual, it can be just due to allergies. Ruptured eardrums can cause a temporary hearing loss, and impacted wax can cause a temporary hearing loss as well. Now, if you go over to the left-hand side of this, you're going to see sensory neural options. So remember, these are permanent types of losses. Aging, presbycusis. By the way, I don't like the word aging. I like having birthdays. The more birthdays I have, the worse my vision is getting. Another type of permanent type of loss is noise damage. Drug side effects can cause hearing loss. Auditory tumors can cause hearing loss. Certain kinds of chemotherapies can cause hearing loss. All of the sensory neural type of losses are permanent. And right dead in the center are those magic mixed ones, which have a combination of both conductive and sensory neural. That can be genetic disorders, infections, head trauma. And just remember, the mixed hearing loss is attacking the entire system as a whole. In 2020, there were approximately 44.1 million Americans with hearing loss. Now, just to kind of give you some perspective, when I started my audiology program in 2004, they beat it into our skulls that we had 34.1 million Americans. So when I graduated in 2007, we were at 34 million. Now, 18 years later, we're at 44 million. I bet you're going to guess what's going to happen next. Due to the aging population in the US, hearing loss is expected to grow to 73.5 million Americans in 2060. That's not long away. Back in 2010, I was reading actually a couple pieces of research that were talking about this, but as of January 1st, 2010, 10,000 people a day turned 65. That was in 2010. So lots of people are aging. Yay, that's a great thing, but it also means that we're going to see more individuals with hearing loss. Looking at this chart though in front of you, you're going to see that 1 in 5 teenagers have some sort of hearing loss. Yeah, we probably know what that's from. 1 in 14 Gen Xers, that's me, have hearing loss. 1 in 6 baby boomers, and 1 in 3 people over the age of 60 have hearing loss. So let's talk about some effects of untreated hearing loss. There's been a lot of research that's come out, especially over the last 10, 15 years about what can happen to us if we're running around with untreated hearing loss. First kind of big section is memory, dementia, and hearing loss. Hearing loss can result in 30 to 40% greater decline in thinking abilities. Untreated hearing loss can increase the likelihood of developing dementia by 2 to 5 times. Now, that's something that we're going to talk in a little bit more detail in just a bit. I don't know if you guys read anything about income and hearing loss. I find this very interesting to know, which is untreated hearing loss can result in up to $30,000 loss of income. And adults with untreated hearing loss have a higher unemployment rate than those who don't. Mental health. Untreated hearing loss results in social isolation, as people tend to withdraw from engagement with friends and family. People with untreated hearing loss are more likely to report depression, anxiety, frustration, and paranoia. Okay, so while you guys are looking at this slide, I'm going to walk through some different sections. So hearing loss may signal other important issues. Now, this does not mean one affects the other exclusively. They just are associated with each other. So let's first start with mental health. In a large national study on US adults and mental health, it was found that increased levels of hearing loss suggested increased occurrence of psychological distress and uptake of mental health medications. Individuals who chose to treat their hearing loss with hearing aids had less risk for depression and were less likely to utilize mental health services. I thought that was really interesting. Balance and safety. Oh, I've got a lot of cool information about this. One of these days, I'll go into it in more detail, which is the risk of falls. So among participants with hearing loss, there was a significant difference in fall risk between those who chose to treat hearing loss and those who did not. Treating hearing loss with hearing aids reduced the risk of accidental injury and falls. Now, the auditory system and the balance system are located in the same area of the inner ear, but that's not what the research was showing. The research was showing that the individuals were having more of a chance of falling because there wasn't as much frontal lobe processing that could occur. So it made individuals more likely to have a misstep and fall. Staying sharp. Treating hearing loss with hearing aids may slow the development of cognitive decline. That's this one up here. Although associations between the two isn't fully understood as of this time, it's been suggested that hearing health increases brain functioning and the feeling of isolation. We're seeing a theme here. Heart health. All right, cardiovascular. The ear can be a window to the heart. Blood flow is essential for good hearing, and if there are any issues with circulation, difficulty hearing could be the first indication. Improvement of glucose control and blood pressure in study participants has had positive effects on hearing abilities. Hearing healthcare cost. This is a great thing. Connection between hearing healthcare and risk of falls and other comorbidities. Individuals with good hearing health save 26% in healthcare cost over 2 years compared to those who lived with untreated hearing loss. Anybody out there have diabetes? You folks need to have your hearing tested if you haven't had your hearing tested, because there's a 2 times the likelihood that you will develop hearing loss due to long-term high or low blood sugar, because it damages the nerves in the inner ear. So it's definitely recommended if you're diagnosed with diabetes, definitely get your hearing checked. Let's go to the next. So if hearing can be connected to all these other things, when is the right time to get your hearing checked? ASHA, which is the American Speech Hearing Association, that's our governing board for audiology. ASHA recommends having your hearing tested every 10 years until you turn 50 and every 3 years after that. Now, BSH, which is blue sky hearing, we follow the ASHA guidelines until hearing loss is diagnosed. Once hearing loss is diagnosed, I see patients every year to track that hearing. Another reason why you may decide to get your hearing tested is because there's a family history of hearing loss. You know, mom or dad or your sisters and brothers have had difficulty, so it's a good idea to get checked out. I had a patient that did this morning. This was so great. She came in and she said, you know, I'm not having difficulties. I just want to get a baseline so I know where I'm at. That's a wonderful reason to get your hearing tested. And preferably, from my vantage point, it's better to get your hearing tested when things are normal, because then we're able to track the progression. And if it's progressing in a certain way, it may lend itself to different issues that are going on. We want to also diagnose and treat problems early. Early intervention is really going to be key in overall brain function. Helps us to diagnose medical conditions, and it also can help to prevent noise-induced hearing loss. So if I'm testing somebody and we find that they're being exposed to noise, we can actually stop that by getting custom hearing protection and thereby reducing the likelihood of further damage. So we're talking about hearing. Let's now talk about the brain. So the 2 major systems are the peripheral auditory system. So that's what we talked about when we talked about the outer, middle, and inner ear. Now let's talk about central auditory function, which is really the brainstem and the temporal lobe. Check out how complicated this is. Okay, so here's the entire auditory pathway. So if you can see my cursor here, this area right here on both sides, this is the peripheral auditory system, right? So this is the outer, middle, and inner ear. So when sound comes into both ears, it's going to meet at the brainstem. Now you're going to notice at this time, the brainstem is not only going to send that signal to the contralateral side, but it will also send a signal to the IPSI or same side. Then what happens is it travels up and meets at this area called the inferior colliculus. Now, it's a fancy name. It really is the place where the sound is transferring from right to left. The brain is actually using, in this time period, is actually using the information from the right and the left in order to find commonalities between ears. So If sound goes into our ears, it meets at the brainstem, it hits the inferior colliculus, and then that brainstem is going, okay, what in the world is helpful here? What's the common signals here? The brain actually will be able to figure out the difference between speech and background noise at that point in time. The amazing thing about the auditory brainstem is that it actually will give a boost in speech volume when it's detecting the same signal from both sides. That's why when you were younger and when your hearing was completely normal, you did really well in background noise because your brain was really able to compare and contrast in that situation really well. Let's kind of take a sidestep here. I want to talk a little bit about hearing loss and dementia. So, the research has been out since 2010, and I'm sure you guys are seeing a lot of things out there. There's a lot of good white paper research. There's some decent trade journal stuff. There's some okay stuff on the internet. But we do know that we're getting this flood of really good information as to the connection between hearing loss and dementia. I do put on here that it's not a cause-effect relationship. If you have hearing loss and it's untreated, it does not mean that you're going to get dementia without a shadow of a doubt. There's still other things that affect that. However, the two are related. Let me show you a chart that I think makes it a little bit easier to understand. So when someone has hearing loss, what's happening is in the brain, there's a higher level of cognitive load. So when you've got higher level of cognitive load, it's meaning that the brain is having to use higher level of processing in order to make up for lack of hearing. Now, if we're making up for lack of hearing, the brain will and can change in structure and function. So it actually can change how it works. With hearing impairment, it also reduces social engagement. So if you take these three things, yes, those three things can lend itself to impaired cognitive function and dementia. But there's also another factor that comes into play, which are a lot of the other health factors, like aging, microvascular disease. I'm totally drawing a blank. I'll come back to it here. Diabetes, those kind of things. Those are all different etiologies that can lend itself to dementia, added with the hearing loss. The thing that we're finding, though, is that hearing loss is the #1 most modifiable risk factor. So there's 7 to 10 risk factors for dementia, one being hearing. And the research is showing is that the most modifiable risk factor is hearing. So we know that that can help improve brain function when we get hearing devices. So when we're talking about brain function, I don't know if any of you have been to your GP and maybe they did something called the MMSE, which is the mini mental state exam. Some of you in your professions might have even performed this testing. It's a test that kind of gives us a general sense of how the brain is working and if there's maybe something that may lend itself to cognitive decline. They'll ask you to remember 5 words, and then later on in the appointment, they may ask you what those 5 words are. They may ask you to draw a clock and do different exercises in order to see how the brain is functioning. But we know through years of doing this test is that it's completely affected by hearing. So if we're having this test performed in office and we have hearing loss, we can't with 100% certainty say that the cognitive decline is exclusively due to cognitive decline, is that it may have something to do with hearing as well. So with that, the FDA cleared recently a new screener called CogniView. CogniView is a really interesting tool which evaluates 4 cognitive domains. So it looks at memory, executive function, discrimination, and visuospatial skills. Now, this is a screening tool. It is not a diagnostic tool, but it does help to kind of give some insight into one of these domains that may be declining, alerting us to start looking at getting somebody in contact with their general physician, neurologist, maybe looking into amplification for improved brain function. It really helps us to detect early issues. And we all know that early intervention of anything is always better. So it's time to improve your hearing. Okay, so let's say you're diagnosed with hearing loss. You now know what type of hearing loss that you have, and you've got sensory neural hearing loss. And because we all know that sensory neural hearing loss is managed by hearing devices, we think that's what we're going to get. It's hearing devices. But I want you to know that it's not all about that. It's really about this trifecta. This trifecta is really culminates what's most important when it comes to improving communication. Number one, auditory training. Look, I didn't even say hearing devices were the number one first thing. It's auditory training is the most important thing. Hearing devices are important, but also hearing accessories are also very important. I want to take just a little bit of time and go through those things and show you what's been going on in the market. It's conceivable that our biggest mistake is making hearing aids that focus our attention when the focus should be enhancing communication. It's not about hearing aids. It's about improving communication. And so this is where the trifecta starts. It starts at auditory training. LACE, which stands for Listening and Communication Enhancements, it was invented about 20 years ago and was a great research-based and incredibly boring program to go through. It was a clunky CD-ROM program. I had recommended it to many, many patients, and every once in a while I'd get a patient who will eke it out and really keep using that system, but it was really hard for patients to keep up with it because it just wasn't that fun. We know, though, that auditory training is a crucial part in training our brain in how to hear. You know, just getting hearing devices doesn't teach your brain how to hear with hearing devices. Auditory training teaches us how to use the auditory information that we're getting in order to hear the best that we can. Here's a short video about LACE.
Because your brain plays such a key role in your long-term hearing, your hearing care professional may speak to you about training your brain. They may suggest you try LACE AI Pro. LACE AI Pro is a scientifically validated brain training program that has helped improve people's listening and comprehension abilities for over 2 decades. In just 15 minutes a day, LACE AI Pro provides targeted exercises to help you improve your communication skills. You'll train your brain to hear better in noisy environments, understand fast talkers, and use visual cues to improve your speech understanding. LACE AI Pro allows you to personalize your training with engaging content, like trivia and jokes. You can even practice with the voices of your loved ones by inviting friends and family to record themselves speaking. You'll also receive communication strategies and best practices to help you cope with your hearing loss. LACE AI Pro was built from the ground up to be effective, engaging, and enjoyable. It's an easy-to-use, time-tested program that helps maximize your hearing and improve your communication confidence.
Okay, so LACE AI. So it's an upgrade of the LACE auditory training program. It's designed to help improve hearing and brain function with easy to use personal exercises. So this is something like Duolingo. I know a bunch of my patients are learning new languages all the time, and Duolingo is really a great example of using an app in order to train. And what they have found through the research is that LACE is not only great for those with hearing loss, but actually those who have without hearing loss. It really can train the brain to hear better. The only reason why I'm using LACE in my office is because it's based off of years of peer-reviewed research. We've got 20 years under our belt of information that we know works well. Also, this has a special place in my heart because a man named Dr. Robert Cerrito, who used to head up UCSF audiology department, was a key person in the creation of this. So a little bit about the research. So LACE, the whole goal is to improve your ability to understand speech, especially when the times get hard. And everybody tells me, you know what, I can hear okay and quiet, I can't hear in background noise. So the research is showing us that doing LACE will actually improve your ability to hear in as little as 10 hours. Now, you're seeing something up there that says QuickSim. QuickSim is a test that allows us to understand how much sound is needed to be heard above the surrounding noise. So this is called the signal to noise ratio. For example, a 10 dB signal to noise ratio means that speech needs to be 10 decibels louder than the background noise in order for you to accurately hear. So the moral of the story is that the lower the score on this, the better. What you're seeing on this graph is you're seeing the improvement noted when performing LACE. So if you see here, for normal hearing individuals, they actually could see up to a 2 decibel improvement in hearing in the presence of noise. Well, what does that even mean? A 2 decibel improvement is equated to a 20% improvement of speech understanding in noise. That now makes sense, right? Now it seems real. If you look at moderate, so let's say you have a moderate hearing loss, you could expect up to a 40% increase in hearing in the presence of noise. If all y'all are in the Bay Area, boy, we know that restaurants are completely noisy. I can't find a restaurant that isn't noisy. And so all of us could really benefit from LACE. So benefits are, helps you understand conversation better, helps to keep up with fast talkers, helps strengthen your memory. They actually, it feels like every few months, they're coming up with a new exercise within the app itself. And one is on short-term memory, working memory, rapid speech. So all of these exercises are designed to help improve your ability to follow conversation. And then this makes sense. It helps us to make us feel more connected. If I can hear you in a restaurant, that's a good thing. It's going to reduce my frustration, so I'm not having to stress so much, so I don't have to give up. I love this part because I get to see what's going on my end. So as you're going through this app and doing the exercises, it's sending me data that I can track in order to help. In case there's something that you're getting hung up on, you and I can talk and we can actually get through it together and maybe give you some different ways of handling those situations. So it's definitely a trackable resource. There's a lifetime membership for it. The app is changing constantly and it's upgrading constantly. If you've got any additional questions, my contact information is going to be available at the end of this. And so you guys can call us or email us. All right, let's jump into hearing device technology. So there's a lot of information on this. There is no way I have enough time to go over every single thing. However, I want to tell you guys some of the cool stuff that's going on kind of globally within the hearing aid world. So we talked about the first part of the trifecta being our auditory training. Now I want to talk about hearing devices specifically. So we were talking about before how the central auditory system, its job is to perform this binaural processing. Its job is to combine sound and compare and contrast both ears, right? So sound comes in both the ear canals, it reaches the brainstem. As it travels up to the brain's comparing and contrast. The inferior colliculus is saying this is important, this is not, and that's allowing us to hear in difficult environments. However, when we have hearing loss, that don't work so well. What tends to happen is you get sound that's at a lower level. It's meeting at the brainstem. The brain starts to struggle in figuring out what's the same in both ears, what's different, because nothing's really sticking out. Binaural processing with hearing devices is crucial. If we look historically at hearing device technology, hearing devices were really detecting sound and sending it into the ear. It was not taking into account the contralateral ear. So if we take this into consideration, like going to a restaurant, if I was in older technology, what would happen is I would have a hearing device on one ear. Maybe my right ear would say, oh, my friend that I'm having dinner with, I can hear her. Maybe my left ear says, this drunk guy over here, he's talking so loud that that's also what my device is picking up. Now, if I'm getting my friend and that guy, that signal is meeting at the brainstem and the brain's going, what's important? What's not? So with older technology, patients would come in and say, Dr. Storm, I hear fine and quiet, I fall apart horribly in background noise. Fast forward to new technology. So now here's what happens with hearing devices. Sound comes in both hearing devices. That sound is being processed by each individual device automatically. Then, many times a second, that information is being transmitted to the other device because each device needs to say, are you hearing what I'm hearing? Because both devices need to work as a team. I always say they need to play nice in the sandbox because if they do, then then your brain will be able to process the sound better. When the brain can't figure out what's common between the two ears, it leads to difficulty hearing in noise. So we know that binaural processing in hearing instruments is going to be really important. So what's going on in technology that does that? First and foremost, there is a 4D sensor technology that's come out. It utilizes sensors to detect head movements and body movements. This is really cool. If we know what direction your head is focused towards, then we have a greater sense of what's important to you. So as your head is tilting up and down and side to side, the brain or the devices will actually detect that. There is also forward and back motion that can be detected. And this was really important when, you've got somebody who's going on a walk with somebody. And so let's say you've got your hearing devices in. If it's detecting that you're in forward motion, those devices are going to amplify differently. Smart speech technology, improves our speech understanding by 61%. And can reduce overall listening effort by 45%. Ear-to-ear wireless technology. So that's when I was talking about these devices talking to one another. That's going to be a crucial aspect for improved binaural hearing. There's another kind of buzz term that we're hearing a lot of in our side, and it's called the deep neural network. So this feature, it enhances speech clarity in noisy environments from learning from experience and improving sound quality. So a little bit more about deep neural network. It's machine learning. So deep neural network is a type of machine learning that mimics the way the brain learns. And it learns by a large amount of data by recognizing patterns and making decisions on that data. So many of the manufacturers put hearing devices on hundreds of patients and had them just go out into the world, and it was just recording, looking at what are the kind of environments that people are typically in. And using that information to kind of create a blueprint of what type of environments could people be in at any given time. Also, there's the DNN is trained with millions of real life sound scenes. So it's also training based on the experiences that the wearer is experiencing. So as the wearer is wearing the devices are learning what's important and what's not. That just improves the overall signal. It helps us to really focus in on what's important and what's not. And it really does allow the brain to get a full idea of the sound picture and not just focusing on the speech itself. It's really important that you understand what's going on in the environment so you can feel that the world is colorful, but we don't want that color to overshadow the speech. Ooh, AI, right? AI is in everything. Actually, AI has been in hearing aids for a long time. Number one that we've seen with AI is the automatic programs. So hearing devices now have the ability to adapt in real time to your environment, optimizing settings for speech, background noise management, music, and it does all the calculations and adjustments without you having to do anything. There is AI enhanced speech clarity, and that's using advanced processing chips to provide a real-time processing. And that's just really the goal is improving the signal speech in the presence of background noise. Deep neural network, like we were talking about before, that has some deep roots in the AI. And there's also AI in apps now, and that's AI for hearing device apps. There's a manufacturer that has created an app that will, in any environment that you're in, it will give you different options in order to test to see if one option helps you to hear better in one environment or another. And it's taking into account the actual environment that you're in. Another cool thing about hearing devices is Bluetooth. I'm sure you guys have all heard about Bluetooth. Bluetooth is a wireless technology that exchanges data between devices with within a short distance. And Bluetooth is absolutely available in hearing devices. And as technology continues to improve, our Bluetooth integration improves as well. Think about, 5 years ago, how your phone worked versus your new phone now. As technology gets better, all of these features get better as well. So when you're connecting to Bluetooth with hearing devices, it allows you to connect to your phone in a wireless fashion. And so whatever audio is emitted from the phone, it goes through the devices. So as an example, if your devices are connected Bluetooth with your phone, if your phone rings and you answer a phone call, it will automatically route to both ears. So as you're talking to the person, you could have your phone sitting on the table and you're still hearing them in both ears. Think of this like hands-free, right? We're hands-free. We're not having to hold the phone up to our ear. And the other thing is you always have better hearing if you're hearing through both ears. Same way if you're listening to music from your phone, it can go through both ears. I've got patients who go on walks who listen to music or listen to audiobooks. The Bluetooth connectivity piece has just really opened up a lot of avenues for patients to help improve their hearing. Another advance in technology has been rechargeability. Rechargeability has been around for a while as well. It's not a new thing. However, it's changing quite a bit. It's getting far better than it ever has been. But I still always go through, differences between battery powered and rechargeable. In the end, it's personal preference. 9 times out of 10, it has no effect or no bearing on how the device is going to function. It's just how we power the devices. So some of the pros of having rechargeable. Well, no changing batteries, that's a cool thing. Typically you're going to need to change your batteries about once a week if you have batteries that are disposable. Less batteries in landfills. We in the Bay Area love that. Depending on technology, a single charge can last anywhere between 60 and 50 hours. That 50-hour mark, that was a device that was just launched 2 weeks ago. Some chargers can actually hold a charge. So you can pull that charger out of the wall and it will continue to have power and charge your devices, even when not plugged directly in. The cons. I find that the cons are more specifically related to individuals who've worn devices before because technology is fallible. Rechargeability works really well, but it's not infallible. Sometimes it doesn't work quite right. For those who have worn hearing devices before, that's kind of a trigger for them to be able to change that battery really quickly and not having to worry about it. So some patients, they like the idea better if they can control it by being able to change the battery whenever they need to change it. And that last one is just exactly what I was talking about, just not feeling as secure with rechargeable, because if they needed to change a battery at a moment's notice, they could. Again, whether it's rechargeable or not, it's completely personal preference. I'll tell you that one of the things that's been good about the new rechargeable is that, you know, with us being in the Bay Area and PG&E liking to turn off our power all the time, these chargers that are holding a charge within themselves is awesome, because if your power gets turned off by a couple days, the charger can continue to charge your hearing devices every night. So the trifecta, right? We've got auditory training, we've got hearing devices. Now let's talk about hearing device accessories. This is something that I think is ignored so much in the field. I want to talk about it because it's important. So, definition of an accessory: a thing that can be added to something else to make it more useful, right? A thing for another thing. That's what we're looking at. We're looking at how do we make your hearing devices more functional, more versatile. So we've got all kinds of options for accessories. With some manufacturers, you've got accessories that you can plug into your television and they can wirelessly transmit sound to your ears. You've got options that you can put in the middle of the table and that will transmit sound when you're in a group setting. So think about being in background noise and putting one of these little discs into the middle of the table. It will pick up sound and route that into your ears. There's also options that you can have a single mic. So you can actually clip a mic onto somebody, and as they talk, their voice will get transmitted directly into your ears. Accessories are really helpful. And what I always talk to patients about is that accessories are great when they work. I have found that patients will be very surprised at how much better they do with an accessory than without. But the important thing to remember is there are 30 days. You have 30 days to use hearing device accessories, and then we can return them if we need to. So we try. I always tell patients, let's try it. Worst comes to worst, we send it back. If anything can help to improve your overall hearing ability, we want to try it. Take a picture of these. So if you have a camera, take a picture of the slide. This is a really cool slide that's got a lot of different options that are free that you can download on your phone. If you guys are at all aware of Caption Call, it's a captioning service that you can use on your cell phone. Your Apple phone also does that. Your Samsung phone also does that. Gallo Pro, this is a really cool one. Gallo Pro was created to be used in theater. The goal is that it can actually provide you with real-time captioning for, let's say you're watching, you're at the Orpheum Theater and you're seeing Cats. And you can actually get closed captioning from the Gallo Pro on your phone while you're watching that show. I won't go through all these, but Tunity I think is a real cool one. So this app actually allows you to, let's say you're in a really noisy bar and there on the other side there's a television playing and you think, I want to see what's on that. I want to hear what's on that television. If you take your phone, you face it at the television, it will actually start to bring the audio in through your phone. So just some fun stuff that is available out there. But there's a lot in regards to helpful tools for hearing. So it's a lot to think about. And now that you know that the trifecta of auditory training, hearing devices, and accessories are all important for the improvement of hearing and comprehension, the next question is, how in the world do you sift through the online noise and barrage of advertisements that you guys get online, through the mail, all kinds of stuff? Regarding hearing aids, this is the best hearing aid. You guys are all getting have you seen this new technology from, new German technology? A lot of it, it's advertising. It's hard to know what really is going to work for you. Here's what I find works in my practice. First of all, anything that we do in my office is based off of best practices. Best practices in medicine generally refers to the methods, intervention, and procedures that are based on high quality evidence. So these are peer-reviewed white paper and journals and are known to improve patient outcomes. So we see it's based on research that we know is going to result in great outcomes. This is not a static thing. This is changing based on what's coming out in the research. So all procedures in my office are based off of best practices in audiology. So we first have to take a good comprehensive diagnosis. That's really important to, getting to the point of figuring out what kind of technology and things that are available to you. We need to assess the entire peripheral auditory system, right? We need to see if there's wax in the ears. We need to make sure the middle ear is functioning properly. We need to check the inner ear to see if it's transmitting signals. And we'll also do some testing in noise because that's going to tell me more of the cognitive portion and higher level of thinking. Once we get the results from that comprehensive diagnosis, then what we're going to do is we're going to be sitting and talking about where's the bone of contention for your hearing? Where do you need to see improvement? We take the information from the comprehensive diagnosis. We take all of those goals that you and I come up with. And what I do is I put together, based on that information, I put together options from several different manufacturers to test. During that time, you and I will go through, it's about a 90-minute appointment. But what we'll do is we'll go through and we will test different manufacturers in both quiet and background noise in order to help figure out what technology is going to work the best. This is allowing me to say in real time, I know this is going to be better for you, as opposed to all the other places which are not doing this type of testing. And they're saying, you know what, you've got hearing loss. I see where you want to improve. Here's what I think you should have. I'm not married to any of the manufacturers out there, much to their chagrin. My most important goal is to make sure that we have as many options as possible for you. After we've gone through the hearing device assessment, we're going to be ordering hearing devices, and then we're going to be doing real ear measurements. So at the day of your fit, real ear measurements are a very crucial part of the proper fit of hearing devices. Real ear measures are an objective measure that takes into account the size and shape of your ear canal. So using these measurements, I go into the software and I make programming adjustments to optimize your speech comprehension and audibility. Real ear is really crucial for the proper fit and personalization to your needs. I also work with patients with tinnitus. We do tinnitus management. There's also accessories that we'll look at together. And the most important thing in all of this is follow up, follow through. In my practice, I schedule patients for several follow-up appointments. Amy, my right hand, is making outbound calls to patients to confirm function, to see how they're doing, to bring them in earlier if needed, and to solve any problems that we can over the phone. So following up after you're fit with your devices is important. Follow through is important.
To start with, first question, please tell us the difference between an audiologist and a hearing aid specialist.
Good question. So hearing instrument specialist, in order to get your hearing instrument specialist license, you need to pass a test and you need to have a high school education. And that gives you the ability to fit hearing aids. Doctors of audiology, we do undergraduate degrees. So my undergraduate degree is in communication sciences and disorders. And then I have a doctoral degree, which was another 4 years in audiology specifically. So audiology is a huge field. Hearing aids is, it's this one lane. And so there's so much more that goes into hearing and processing. And that's why, when you go to see an audiologist, they're going to have a lot more of that background information. And they should know that it's not just about hearing, but that's also about comprehension.
Does insurance pay for hearing checks and like consult insurance? Does insurance pay for it?
Yes, yep. So if you've got Medicare, Medicare will pay for one hearing test a year unless medically necessary, and then they will do pay again. Most insurance plans will cover one hearing test a year.
I have asymmetrical hearing loss on the left side. This ear qualifies for a hearing aid, but the right ear does not. Kaiser has recommended no intervention at this time, yet I'm acutely aware of struggling to hear in certain acoustic situations. I'm considering trying the iPhone system with the Pro earbuds as a low-cost entry. Can you comment on this as an initial plan?
I think it works just as good as any. You know, if you're going to try an over-the-counter option, try it. See what happens. There are great options that are available for single-sided hearing loss. There are options where we actually will put a microphone on the poor side that transmits the signal over to the better side. There's monaural amplification that works very well. But I think it's a great first start to getting sound, is to try especially if you've got them.
I recently learned about glasses that project closed captions. What do you know about them?
Glasses?
Glasses, yeah.
Not very much, clearly. I only know about the glasses that are worn at like movie theaters, where you can get them to where when you wear the glasses, they'll actually have the closed captioning in them. Above and beyond that, I don't know. It'd be interesting if there's a live version. That would be really cool.
Yeah. There were a few comments and questions about lace. I recently tried to buy lace, but their website says it has been sold and isn't currently available. Do you have any updates on that?
Lace, the original lace is no longer Lace AI. You do need to go through an audiologist office. So there has to be a trained facility.
Mm-hmm. Okay, so it's also because somebody said it's as of today not available in the Apple App Store. I mean, that would explain it, right? Yeah.
Yeah.
So then, what is your opinion of lyric in the ear devices?
That's a good question. You know, 10 to 15 years ago, I was fitting lyric. Lyric is an interesting one. So lyric is a semi-implantable device. So what we do is we put this device into the ear canal at a pretty good depth, and we leave the device there for 2 to 3 months. Now, that device does not come out when you shower. That device does not come out when you sleep. It will eventually lose its battery life and will need to be replaced. It's based off of a subscription model. So to get lace, you're going to be paying annually for the devices because they're going to have to be changed routinely throughout the year. One thing that I found with lace, for the right person, it's perfect. I remember this patient of mine that was pretty far along in with Alzheimer's, and he was really big into just yanking whatever he had off of his ears. Lyric was awesome for that because he couldn't get to him. Lyric is also, it's great for individuals who have more than just a high frequency hearing loss. And I can't really go into that in too much detail because I'll spend too much time, but it depends what type of loss that an individual has that will make them more of a candidate. The one caveat that I will say is that because we have a device that's being left in the ear for so long, there is a really good chance that water is going to get up around it. And so what tended to happen is when I would pull those devices out to replace them, the ear back there would look pretty chewed up. Think about like if you put your hands in the bathtub for 3 hours, you know, you're going to get wrinkly and pruny and the skin's starting to slough. So it does cause some issues there. For some patients, it's not a big deal at all. For some patients, they have issues. So it's a little, I think with having something in your ear all the time, there's just other things that could occur because of that. But then there's some positive things for certain individuals too.
Are there any hearing aids that help with balancing? I'm told that I have a permanent problem.
Balancing, like vestibular balancing, like this kind of balancing. If that's what,
It is, I mean,
if
she
we're
doesn't.
talking about this, so one thing that I have patients that ask me this all the time. So auditory system, vestibular system, same area of the inner ear. One typically does not directly affect the other in that way. The balance system will not typically be, actually, the hearing will not be affected by what's going on in the balance system. So in regards to hearing aids don't help with balance issues because that balance system, although it's located in the same area of the inner ear, the hearing portion will not affect that in a positive way. Balance retraining is great though, physical therapist.
Yeah. Is there a hearing device that works best for someone who is playing a musical instrument?
Good question. So there's a couple manufacturers that have done a really, really good job with musical processing. When I started my career, patients hated music. They loved music, but they didn't like the way that it sounded. And that was because hearing aids really were hyper-focused on how they're bringing in speech and not how we're managing music. But to a lot of us, music is a big deal. And so audiologists really, worked a lot with the manufacturers to focus more on how they process music. One manufacturer that's done the most research in the field on music is Widex. Widex has a long-standing history of research in regards to music processing. With that being said, I've seen some individuals who have done great with other types of technology. This is where, though, that hearing device assessment, where we're actually able to assess in the office, that's really what's going to be most helpful in understanding that, because the way that my brain processes music is based on the fact that I've played piano since I was 3, and it's based off of my years of experience. However, with that being said, someone else who could have played the piano since they were 3 years old still can process in a very different way. And one manufacturer might sound better than another manufacturer for music.
Are there any sound amplification devices that you might recommend to those for whom hearing aids are not a good fit? For example, due to dexterity or cognitive issues?
Lace. The other thing is sometimes I'll have individuals, and I'm going to give you an extreme case. There are times when I get calls that somebody's in hospice and we need something right away in order to help them hear. And in those situations, or in situations where they're very specific to, maybe I'm not a candidate for hearing aids for whatever reason, but I need something to help when I'm talking to my daughter. Something that's really inexpensive is it's called a pocket talker. Pocket talker is earbuds, little box, and which has a microphone on the end, and you just set it on the table and it picks up the sound around you and transmits it to the ears. It's not a hearing aid. It just transmits sound and amplifies sound. But it can be something that's helpful for somebody that might not be a really good candidate for amplification.
So the next question, can hearing aid be part of eyeglass stem?
So it was. It's so funny because I get this question more oftentimes than you think. So when I was in school, we had this huge case that had all these really old hearing aids and all kinds of stuff in there. And one was the ear glass hearing aids. And so many years ago, it was actually back in the 60s, they used to have these big black clunky glasses, and the hearing aid would actually be hooked to it. But can you guess why it didn't work?
You took it.
Can't take your glasses off anymore. It's like, if you're like some of us, we have our glasses on and off all the time. So that idea is no longer something that the manufacturers are focusing on.
There are quite a few questions actually about costs in general, about appointments with you, I assume, and follow-up, and also for devices. I think devices, that wasn't really touched. I mean,
Yeah,
pretty expensive.
kind of generally, yeah, just kind of generally. Hearing devices and services can range, and it's based on the type of care plan that's chosen, which is the services portion of this. Devices and services can range from anywhere between about $2,500 an ear to upwards of $4,000 an ear. That's going to be dependent on technology, but it's also going to be dependent on the service package that's chosen at the beginning. The appointments beyond that are going to be covered depending on how many years that you've decided to elect for. But even I have had patients who've come to me who've gotten hearing aids somewhere else, right? And we've got plenty of those patients. And so they talk, when patients come in, it's like, okay, I want to reestablish myself somewhere. And so, we definitely help people who haven't purchased hearing aids here. I don't care about that. I know that I've had a lot of patients coming in from Kaiser because once hearing aids hit a certain year, they're not managing or repairing them anymore. And that doesn't need to be that way because many things are repairable. So yeah, that kind of gives you just a general range in that.
And then there was a question about Medicare, if Medicare covers LACE AI. No.
Medicare covers one hearing test a year.
Mm-hmm.
Just like with eyes, Medicare is going to cover your vision test, but not necessarily cover much more than that. Same way with ears. No matter how much you fight.
Are there any hearing aids that stay in the ear reliably when one repeatedly puts on and removes a COVID mask that uses ear loops?
Yeah, it might be a style, might be the way that we hold the device on our ears. But yeah, there's different style options that are different. Sometimes I have patients who are like, you know what, I'm wearing masks all the time and I want to be able to take them off and put them on really quickly. Sometimes we elect for either something smaller behind the ear or maybe something that only goes in the ear.
What is your opinion of cochlear implants?
They're awesome. So cochlear implants are to profound loss what hearing devices are to all of the rest of them. Cochlear implants are really a really neat side of the field that, I think we FDA approved cochlear implants back in the 80s, early 80s. When I was working at St. Louis University, I was working with Children's Hospital, and we were doing anywhere between about 2 to 4 implants a week. And that could be all the way down to 6 months old baby. So cochlear implants, great technology, changing just as rapidly as hearing devices. So whenever anyone's a true candidate for cochlear implants, I always recommend that they have an appointment with a cochlear implant audiologist every 5 years. And the reason for that is because every 5 years, technology is going to change so much. So maybe today, I'm not personally ready to have a cochlear implant, but maybe 5 years from now, because the technology is changing, I might. There's a company that came out with, and it's only been approved in Europe, but there's a company that came out with a fully implantable cochlear implant. So your implant is even powered under the skin. It's pretty cool.
There are actually quite a few questions about tinnitus and what can be done for it, want people to know more about treatments. So.
Sure. You want me to put up my slides on tinnitus? Or can we just say it? I can just say it. It's okay. So tinnitus. Tinnitus can arise from many different many different places in the body. I had a patient of mine years ago that when he would come in and I would shake his hand, if I squeezed his right hand just enough, his tinnitus would roar in the left ear. Tinnitus is very specific to each individual. Tinnitus is often correlates with hearing loss. A large proportion of people who have hearing loss will have tinnitus. Not everybody, but a large portion will. The tinnitus, when you do have hearing loss, can come from one of two places. Number one, you guys remember the peripheral auditory system ends with the auditory nerve and the cochlea. So one of the things that can happen with hearing loss is that those hair cells that go back and forth, those hair cells can be damaged. And we know they're damaged because we've got hearing loss. And so what happens is that sound is transmitted to the brain when no sound is present. So someone will say, oh yeah, I hear tinnitus on this side, but I know it's not coming from out here, it's coming from right in here. So those damaged hair cells can actually fire randomly. The other option, the other thing that could be happening, is that the area in the temporal lobe where speech and sound are processed, sometimes when the temporal lobe isn't getting the sound that it needs, it will fill in the blank. Think phantom limb. I have my arm amputated and 6 months later, my elbow's itching, right? So the brain is missing a piece, so it's filling in the blank with a sound that it needs. Number one, and only research-based management protocol, hearing devices. Not over-the-counter pills, not clanking together 2 coconuts. You will find thousands of things online that will tell you exactly how to get rid of your tinnitus. There are no medications. If there was, I'd be handing them out like candy. The number one thing for management of tinnitus, and it's always management, there's nothing that gets rid of most tinnitus. There's nothing that's going to get rid of it. What we do know that we can do is we can help to mask it. And if there is hearing loss, providing sound to the areas of the ear that are damaged can really help to mask that. So I have a lot of patients who have tinnitus who, when they're wearing their hearing devices, their tinnitus is either softer or non-existent.
Here's a question about bone conduction. Is it useful for any situations? And maybe what is it actually? So
okay, so I'm guessing that this person is talking about a bone conduction hearing aid, which a bone conduction hearing aid is going to be very specific to a certain type of loss. So we were talking about conductive versus sensory neural. In regards to a bone conductive hearing aid, if we have a conductive issue, there's a problem with getting sound to the cochlea and the nerve. But once we get the sound to the cochlea and the nerve works and the cochlea work beautifully. That can be a time where a bone conduction hearing aid is recommended. But it's a very specific type of device. It sits back here. They will actually go in and put in they'll screw in an abutment in the mastoid area. They'll let that abutment heal, osseointegrate, and then they'll actually attach a device that pops onto the back of it. And that way, when the device is detecting sound, it will actually stimulate the cochlea and the nerve and bypass this part, which is where the problem is to begin with. But those who have sensory neural, bone conduction is not a good option.
somebody asks about, so if I have a vestibular problem, it's a different doctor that I need?
So for vestibular, first things first is get your hearing tested, because of the fact that sometimes with certain vestibular issues, it can show itself in the hearing. So I know I was telling you both before that they don't correlate together. They do in regards to if there's something going on with the auditory or the vestibular system, it can affect the outcome of the hearing test. So one thing that I always recommend, let's get a hearing test and then get that person to, I don't do in my office, my background too is in vestibular rehab. That is not a part of my clinic here though, so I typically will refer out for a vestibular assessment, which will be done by an audiologist as well. I typically will recommend to either UCSF or Pacific, UOP.
So then all that's left to say is thank you very much again, Dr. Storm. That was amazing. And I think there were many thanks and thank yous in the chat.
Thank you. I really appreciate you guys inviting, and I hope to see you guys all again.